As Alexandra introduced, I'm from IHE, and IHE is a particular association because it's mainly made by two sections, vendors and users. And vendors and users are getting together to share their experiences and their needs and the challenges so that we can find a common solution through specifications and through testing, which is one of our major outlets. So I would like to discuss today something that maybe it's known to most of the vendors that are here. So what IHE has done is basically listen to our vendors and get a sense what are the challenges and the opportunities around the implementation of HDS in a vendor product. So I would like to touch on that and also touch on a few other elements pertaining how effective implementation should be. So a bit of word of myself. I am from Daedalus, my day job, but I am also a board member of IHE International, and since 2009, so basically the creation of IHE International, a board member of IHE Catalyst in IHE Europe. And I've been vendor co-chair for IHE Europe for 8 years in the past. So vendors produce manufactured products. And when you look at products, you look at maybe something that you buy from somewhere. But that something that you buy has a life cycle. It starts with an idea, and goes into implementation, and then goes into evolution. So this evolution of the product, the life cycle that is roughly represented in the picture there, is called a roadmap, which is something that we use as a word for meaning different things. And I have heard already this morning few instances of the word roadmap being used for different reasons and for different purposes. But in the context of a product life cycle, this assumes a very important role. So what are the key components of a product roadmap for a vendor? So it starts with a long-term trajectory. Where I'm going with the products, what I'm trying to solve in the industry, in the market, is the initial problem statement that the product will come from. But then we look at the capabilities, how you implement this into functionality that can actually be delivered in the market. And therefore, you look at the use cases that are relevant for specific stakeholders. Are the stakeholders clinicians? Are the stakeholders administrative people? Are the stakeholders the patients? All those stakeholders. We look for input from our users, from the customers, from the regulators, and from the market demands at large. We plan the functionality implementation, and we have deliverables. Deliverables can be multiple things, can be a software package, can be a managed service, can be documents, can be a lot of things. But all of this combined is product. And then, of course, we attach all this into a timeline. So we have a timeline. So if things happen in a sequence, in a certain sequence, if things happen in a way that the capacity and resources that are available in the company can actually achieve that goal. So what are the influencing factors then? So as the customer needs, we look also at the competitors, because the competitors may find different ideas or better ideas, and when we look how we can implement or beat the competitors and in that. We look at the market trends. AI is a market trend. It's coming up. So you look at this early on maybe and saying, okay, well, there is opportunity there. Maybe I want to start thinking about that, even if no one has asked me that yet. And of course, regulations that are all around us in any stage of our implementation. So what is the role of HDS when it looks at roadmaps? So when you look at this from a vendor perspective, so we have mandatory interoperability. So we have to implement certain aspects of interoperability to make HDS happen. Otherwise, it won't fly. It won't fly at all. So we need to look at those interoperability and mandatory aspects to be implemented. We have data privacy, security, access, login, all this small pieces that seem small but are not small at all that goes around it. We need to align with industry standards as they evolve. IHE and HL7 are working together in creating HDS technical specifications. Well, we need to look at those, okay? And There are things that maybe we support already, maybe there are other things that need to be implemented. And then there are conformity assessment requirements. You just spoke about that, and it's going to be a very tough point, but it's nonetheless, it's a necessary point. We understand that. The way it's implemented, though, it's the key element, but that's a separate discussion, I guess. So there are challenges around this. The complexity, so the technical and legal implications around the regulation is a challenge. You know, you need to understand, you have a common understanding of what is expected from the vendors to be implemented in a fair and transparent and level way, so that we all do this, we are all going in the same direction. We need to look at resource allocation. So vendors do not have infinite resources, so we don't have infinite capabilities, so we need to balance the requirements and for the timelines with our internal capacity. That's how the roadmap really works. You know, you start now and you have a date in the future when you release something. And it's not that in the company you say, oh, we have HDS now, there you go. No, it doesn't work that way. We have an evolving framework. Right now, the technical specifications are evolving, and we will evolve in the future eventually, because this is the natural things. If you look at the history of international standards in the last 30 years, they have evolved and will evolve, because the technology will evolve, the market needs will evolve, the user requirements will evolve. There are diverse priorities that may be in conflict between different stakeholders, users that want to use the system to exchange clinical data, developers and manufacturers, products, and regulators. So that needs to be find a common ground where we all understand from each other what are the expectations, besides what is written in the rule. So what are the roadmap success in the context of an EHDS? Is we need to collaborate early. We need to start collaborating very early, engage with regulators and affected stakeholders, understand the point of view, understand the pain they want trying to solve from a regulatory perspective, from a policy perspective, and see, okay, let's see how we can align. Because if there's a misalignment there, I don't see that work very well. Vendors need to invest in expertise. We need to build capacity in teams so they're familiar with what EHDS entails, requires, and needs. We need to leverage standards more than ever. We need to look at the HL7 and IHE work and help them as much as we can for them to accelerate the ability to create stable and reliable interoperability standards for the HDS. And then we need to iterate frequently. We need to implement, test, implement, test, implement, test, eventually conformity assessment. We need to verify and validate each and every steps of the line. So for those of you that know me, know this is my go-to slide, okay? So this is the slide where I like to picture what the industry for the last 25 years through IHE has really looked at from the iterative testing validation process when we create products and we put products in the market that needs to be interoperable. So it's a combination of how vendors and users come together in a trajectory where all the pieces of testing and validation are available to the vendors, as well as the outcomes of those tests and validation are available to the users. So if you look at this testing continuum, and if you look at how this test is continuous, so you have a plug-a-thon, which is basically early on assessment of what needs to be done without no testing at all, potentially, where you start brainstorming about new ideas or new things, or you need to refine new ideas into something that may be transferred to specification. The connectathon, which is in reality an effective tool to test and validate under quality control environment those specifications. Then the projectathon, which is basically the same thing as the connectathon, but it's under control of someone else, not IHE. In this case, could be the European Commission, for instance. In other places, can be other governments. We have plenty of examples of how projectatons really work. But the methodology and the approach is the same. So that the industry that goes to the plug-a-ton, that goes to the connect-a-ton, and goes to the project-a-ton, they know the drill, they know what to expect, they know they come prepared, so the outcome is secured. Now, these three elements sit in different times of the product life cycle, the one that I have introduced before. So there are times where you have ideas at the beginning of your process. Well, maybe the plug-a-ton is very useful there, because then you can capture the ideas that you have or the ideas that the others have and make them in a more coherent way into something that becomes a product eventually. When you start developing, you start creating the software, the prototypes, and the like, you go to connect-a-tons and you test your capabilities, the product capabilities against those specifications. And eventually, when the product is mature, project-a-tons will kick in, and then you go to the market. How this take? Okay, it will take few months, okay, or few years, depending on the type of products. But if I can give you a rough estimate that the planning phase could be anything between, and I'm talking from any level of company you may find, from micro to large vendors, and of course, the largest vendors have more resources, but at the same time, they have more constraints internally. The small vendors have less resources, but they are more agile into taking decisions. You wake up in the morning and you say, hey, that's a good idea. Let's go. Okay? Doesn't work that well in the large vendors. But, 3 to 12 months. Then you have 1 to 2 years to go through all the motions of creating a product. It can be even more if we're talking about medical devices, where you have additional regulatory needs. So that's how the things all compare, how you look at EHDS in terms of regulation and requirements, and how that can fit into a real established way that the industry is behaving when it comes to developing and manufacturing products. So I'd like to introduce that we have a few events that are coming along. So in the first one, we're going to be in the IHE Plug-a-ton and IHE Connect-a-ton in Vienna, 2025, end of June. We will have another one in Plug-a-ton and Connect-a-ton in Brussels, 2026, probably March. And after that, 26 and beyond, project-a-tons and conformity assessment, whatever it is that is required from now on. But right now, the first year, from now to March 2026, is the time that really is relevant for the industry to consolidate what need to be done for the EHDS. So product roadmaps, as a conclusion here, product roadmap is balanced the internal goals with external forces. In this case, the external force is the EHDS, which is the Commission pushing the regulation to the market. The EHDS, as I said, is a challenge for some things, and our opportunity is an opportunity for others. We need to align the timelines as quickly as possible, because that is where I see the most risk. And if we do, then the industry can function as an accelerator, because we're already there. So if we do this right, products that are already installed can be easily expanded to include XGS support, which will be the ultimate accelerator of the implementation. And that's my final statement. Thank you.